Hello, so our presentation is on chronic kidney disease, and I am Catherine Masias, and my partner is Fanny Purnomo. So, what is chronic kidney disease? Chronic kidney disease means that your kidneys are damaged and cannot filter blood the way they should. This damage can cause waste to build up in your body and can ultimately cause other major health problems. If it worsens over time, it can lead to kidney failure, needing you to actually have a kidney transplant to stay healthy. And then the picture on the right shows a picture of a normal kidney, and then the kidney on the right is a diseased kidney, and the scar tissue, as you can tell, it's withered, and there's damage to the scar tissue and the glomerulus and the tubules. So this is the etiology of chronic kidney disease, and the main causes you can see on the chart is diabetes, which has 38%, and high blood pressure, which has 26%. So in diabetes case, too much glucose in your bloodstream will damage your kidneys filters, and over time they can wither and no longer do a good job filtering waste and fluids from your blood. In high blood pressure's case, your blood vessels in the kidneys are of course damaged, and so they will not be able to perform as well. And this can actually build up extra fluid in the blood vessels and can raise blood pressure even more. And then the third biggest cause is, oh, I don't know if I'm going to say this right, but I think it's glomerulonephritis, which is a disease that can cause inflammation and damage to the kidneys filters. And then lastly, it's genetically inherited diseases, and they can also be a cause, but of course they aren't as common as the other health conditions. So this is the graph and the data of the health conditions. So unfortunately, you can get this disease at any age, and a person can actually lose up to 90% of their kidney function before any symptoms appear. But in any case, as it progresses, symptoms can include and are not limited to feeling more tired, trouble concentrating, poor appetite, trouble sleeping, muscle cramping at night, swollen feet and ankles, puffiness around the eyes, dry, itchy skin, and the need to urinate more often. So, of course, there are ways to prevent chronic kidney disease, and managing health conditions like diabetes and high blood pressure can reduce the chances of getting chronic kidney disease. Um, so, making healthy food choices is definitely recommended to prevent this, and incorporating plenty of vegetables, fruits, whole grains, and healthy fats can give your body the necessary nutrients and vitamins that it needs to prevent diabetes and high blood pressure. It is also important to limit and, if possible, even eliminate highly processed foods, meats, dairy, added sugars, alcohol, and heavily salted meals to reduce the intake of saturated and trans fats, um, processed sugars, and even toxic chemicals that are in these foods that can, of course, harm our bodies over time. It is also recommended by your doctors to be active for at least 30 minutes every day and to get at least 7 to 8 hours of sleep. But if you're ever in doubt, you can always ask your healthcare provider to test your kidney health, since symptoms don't tend to appear until the disease has almost fully taken over.
There are five stages of kidney disease. The stage of kidney disease can be determined by a blood test, or we call EGFR, estimated glomerular filtration rate. EGFR is a number that is based on creatinine level, age, sex, and race. All of these factors are very important because people's bodies are different. Stage 1 to 3 usually don't have symptoms, and so many people don't even know they have it at that point. On stage 4 means the damage to the kidney is already severe, but still may not show very obvious symptoms. By stage 5, the kidneys are nearing failure or have completely failed, so may notice symptoms caused by the waste and extra fluid building up in the body. Treatments of chronic kidney disease. Although chronic kidney disease cannot be cured, it is possible to slow the damage to the kidney. Not every treatment option will work for every person, and there are many factors that determine which option is best. Controlling protein in the urine. By restricting the amount of protein in the diet or medications, and reducing the use of and the dosage of drugs that may be toxic to the kidney. Taking ACE inhibitors or angiotensin II receptor antagonist agents to slow the progressions to chronic renal failure. Optimal diabetic controls and cholesterol controls. As we know, diabetic and high blood pressures are the two leading causes of kidney disease. So the best way a person can prevent getting kidney disease is to control their blood sugar level and keep track of their blood pressures level every day. Renal dialysis. Why is dialysis? Dialysis is a treatment that filters the blood of waste and extra fluid when the kidneys are no longer able to perform. This functions using semi-permeable membranes. It is a process in which the blood is being cleaned by artificial means. It occurs through a semi-permeable membrane that allows small particles through, such as waste, and keeps large particles such as red blood cells. Dialysate is a special fluid which is made up of many electrolytes we have in our bodies. The waste products flow through the membrane and then into the dialysate. There is two types of renal dialysis. The first one is peritoneal dialysis. The peritoneal membrane is a dialyzer. Peritoneal dialysis uses a space inside the belly called peritoneum as a filter to clear the waste and extra fluid from the blood. You will need to have a catheter to place in your belly before. The catheter is placed by a surgeon outpatient and will take a few weeks to heal before starting dialysis. Two options. First, CAPD, continuous ambulatory peritoneal dialysis, happens during the day. Patient exchanges dialysate 4 to 6 times per day. Continuous cyclic peritoneal dialysis (CCPD) happens while you are asleep. Utilize a cycler machines to automatically perform exchange at night for 8 to 10 hours. The second type of renal dialysis is a hemodialysis. For the access, patient will start with the AV fistula placed in the arm or neck before starting these treatments. However, in the emergency situations, central venous catheter to the neck will have to be placed. This is only for temporarily to avoid the risk of infections. It is normally done in the outpatient dialysis unit. Patients typically require hemodialysis 3 times per week. Sessions last 3 to 5 hours each. The pictures below explain how the blood levels the patient enter the dialysis machines goes through the filters and then back to the patients. You can see the two tubes, one takes blood away from the patient to the machines and the other brings blood back to the patients. The next slide, it shows the dialysis modality data of comparison of survival curves for kidney disease patients with a subclinical peripheral arterial disease between hemodialysis and peritoneal dialysis. The curve here shows a statistically significant difference between the two groups. Patient survival in the group on peritoneal dialysis was lower compared with those on hemodialysis. The last and the best treatments is kidney transplantations. Transplant is considered the best treatment options for patients with kidney failure. Patients who have successful kidney transplants can stop the dialysis. Renal transplantation is the organ transplant of a kidney into a patient with end-stage renal disease. Kidney transplantation is typically classified as a deceased donor or cadaveric or living donor transplantation depending on the source of the donor organ. The operation takes approximately 2 to 5 hours and most people need to be hospitalized for 1 to 2 weeks after the transplant surgery. Once a person receives a kidney transplant, they must stay on immunosuppressant medications, also known as anti-rejection medications, the whole time's life of their transplanted kidney, so that body will not fight the new kidney. A complication is chronic kidney disease leads to end-stage renal disease. Diabetic retinopathy is caused by the damage to the blood vessel in the retina of the eye and can result in gradual vision loss or blindness. Diabetic neuropathy is the most common complications of diabetes. Diabetic nephropathy can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease and end-stage renal disease. Now we've come to the end of presentations. Let's recap the most important points to remember. Okay, there is no cure for chronic kidney disease. When the kidney are permanently damaged and do not work as well as they should, it is called chronic kidney disease. Diabetes and high blood pressures are the most common causes of chronic kidney disease. The best way to prevent kidney disease are to keep a healthy blood sugar level and a healthy blood pressure level. Finding and treating kidney disease early may help prevent kidney failure. The dangerous thing about kidney disease is that many people with this disease do not know that they have it until it becomes severe. Support group. The stress of illness can often be helped by joining a support group where members share common experience and problems. Thank you.
And then these are the sources for the slides. Thank you for listening to our presentation.